Hey everyone, and welcome back to another video. In today's video, I want to talk about a topic that is quite challenging if you've experienced it, acute lower back pain. We'll explore what can cause lower back pain, some tips to help you manage if you are experiencing it, and some gentle exercises that can help. Lower back pain can be quite complex due to the multiple connections within the body, and if you are experiencing lower back pain, this video will be helpful for you. Acute lower back pain is typically describing the first 7 to 14 days after developing lower back pain. Lower back pain can have many causes, with some as simple as bending over to pick up a fallen pen, to lifting heavy boxes repeatedly, or from sustaining a twisted position, just to name a few. Sometimes it might not even have a clear cause at all. From a muscular point of view, lower back pain is a result of spasms to the muscles of the lower back. There are a lot of muscles that can cause lower back pain if we take a look at the anatomy. We'll break this up into a couple of sections to make it a bit easier to understand. The lower back anatomically is talking about the region of the lumbar spine from the L1 to the L5 vertebra. This is the region that most people will point to when they are experiencing lower back pain. Within this area, there are many muscles and attachments, some of which can come from outside of this area, as you will see. Let's start by taking a look at the superficial or more surface level muscles. We can see that there are muscle attachments that come from the thorax or the trunk, with big muscles such as the latissimus dorsi, external and internal obliques. There are also muscles that come from the pelvis up towards the lower back region, such as your gluteal muscles, maximus and medius, and your piriformis. Deeper muscles will also affect the lower back with muscles such as iliocostalis, longissimus, and multifidus, which have varying connections between the thorax and the lower back regions. The quadratus lumborum, which connects the pelvis to the lower back and the lower rib cage, can also be a culprit of lower back pain. Any number of these muscles can affect the lower back and cause pain if they are in spasm. And this affects the complexity of lower back pain. As you can see, muscles which are generally associated with the thorax or the pelvis are interconnected with the lower back, and so can be a contributor to lower back pain. When we suffer from lower back pain, it is very common to find simple movements to be very difficult. For example, getting in and out of bed, sitting and standing, putting on pants or socks, getting in and out of a car can all be excruciating. With this in mind, let's get into some tips on how to manage your lower back pain. For tip number 1, don't stay too long in one position. It can be tempting to find the most comfortable position and stay there when you have lower back pain. But this is a trap. Doing so will lead your muscles to seizing up more and make it more uncomfortable for you when you do have to move. My usual recommendation is to stay active by only sitting 30 to 45 minutes at a time before getting up to walk or move for about 5 to 10 minutes. This is to let your muscles have some blood flow and to have some movement. This is not to say that it will be easy to do when you have lower back pain, but it is way better than the alternative of letting your muscles stay in one position for 2 hours or more and then struggling to move afterwards. If you have just started experiencing lower back pain, this is really important, and if you take nothing else away from this video, try and do this. Earlier I spoke about how getting out of bed can be an issue, and if that is an issue for you, tip number 2 is roll out of bed instead of sitting up. If getting out of bed is difficult due to your lower back pain, especially if you can't sit up like you usually do, rolling onto your side and using your arms to push your body up can be a really helpful way for you to get out of bed in the morning. This will take some of the pressure off your core and lower back and thorax muscles and instead put that load into your arms. This can help minimize the pain of performing this action, especially when you're getting up out of bed first thing in the morning. While we're on the topic of getting out of bed, a simple exercise that you can perform before getting out of bed in the morning is gentle knee rocks. This is done by bending both your knees up and then dropping them together towards one side as far as you are comfortable before pulling them back to the middle and then going the other way. You might find that it is difficult to move at the beginning, but with more repetitions, your knees should get further down towards each side. This is a really nice way to warm up some of the pelvis and lower back muscles before getting up in the morning. Perform at least 10 to each side in the morning before getting out of bed. Another exercise which is generally really helpful is a supine glute stretch. I showed a seated version of this exercise in a different video, which you can find here. The supine version allows for the lower back to be more supported and is usually much more comfortable to perform, especially if you are suffering from lower back pain. To do this, bend both knees up, place one foot onto the opposite knee, and use both hands to pull the knee that is up towards your chest. Pull as far as you are comfortable until you feel a stretch in your glutes, and ideally no lower back pain. Hold this for 30 seconds and then repeat it on the other side. My final suggestion is to do an exercise that is known as pelvic tilts. This exercise is a simple movement that will help activate your deep lower core and glute muscles. While lying on your back, have both knees bent up. Think about drawing your belly button in towards your lower back and roll your pelvis up towards you. You should feel your lower back flattening against the bed or the floor as you do so. If you feel some back discomfort when you perform this, you might want to reduce the range in which you roll your pelvis up. Find a range which is comfortable for you to do. Hold the tilt for 2 to 3 seconds and then gently let your pelvis roll back to neutral. Perform 10 repetitions for 3 sets. Remember that these exercises should be performed gently and without any sharp pain in your lower back. Acute lower back pain should gradually improve day by day, and comfortable movement should return over a period of a week. All the tips and exercises shown in this video are to help you manage when you are suffering from acute lower back pain, but they shouldn't replace being assessed and treated by a physiotherapist. If you have injured your lower back, don't delay in seeking professional medical help, as proper treatment can make a big difference in the recovery of your movement and function. And that's a wrap for this video for managing acute lower back pain. If you've enjoyed the video or found the content helpful, please hit that like button and leave me a comment down below. Subscribe to the channel to get more videos on injury management and rehabilitation just like this one. Thanks so much for watching, and if you have been enjoying the content, maybe you'd like to check out this video here.